Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the programme tonight, Delhi in just 2 hours from now goes into a night lockdown with a surge in COVID cases. In fact, in several states now, we are seeing a surge in cases. The centre is rolling out boosters for senior citizens and vaccines for kids eventually, something that should have happened much earlier, and yet life, by which I mean political rallies, they go on as usual. Pleas by courts to delay elections are ignored. Political arithmetic comes first in our country, perhaps at the cost of lives. Are we headed the same way as we did a year back before Delta struck? That is our top debate tonight. Rallies by day, curfews by night. Are our leaders paying only lip service to fighting Omicron? Next up, R.S. Sharma, the man behind the CoWIN app, on the A to Z on how you will need to register to get your third dose if you are 15 to 17 years of age and if you are a senior citizen who is eligible to get that third dose. But we're going to bring you first images, video of the political rallies which are now going on across the country by all the major political parties. The numbers are absolutely staggering. Let's bring up that video to give our viewers an idea of some of the numbers we are seeing. The Prime Minister campaigning heavily across Himachal Pradesh, where he was there today, in parts of Uttar Pradesh, elections soon in Punjab as well, and the numbers are huge. There have been hundreds of new COVID cases which are being registered in our major cities now. The Omicron threat is very, very real, and yet in a scenario like this, we continue to have election rallies and no signs whatsoever, no discussion of actually putting an end to this. Why? Do human lives not matter? Joining us now, Pawan Khera of the Congress, Alok Vats of the BJP, Nahid Lari Khan of the Samajwadi Party, Varun Khera, who's the owner of the Imperial Spice and Cafe, whose business is going to be affected in a couple of hours from now, and Dr. Rajesh Parekh, the Director of Medical Research of one of India's leading universities, hospitals. Thank you all very much for being with us. Let me come to you, Mr. Vats, first. The Prime Minister leads by example. He's the Prime Minister of our country. He came on television, spoke about the need for all of us to be careful. Why isn't he cutting down on his election rallies?
I think so. At present, for such matters, the Supreme Court is ruling the country. I think there will be a direction from Supreme Court to ban the rallies, and all the rallies will be banned. Yes, the way the rallies are taking place, whether it is BJP or others.
Yes, all parties, totally, absolutely.
It is totally contrary to the norms of COVID or Omicron.
No, but so therefore, as a responsible political party, and I will ask this of every political party, rest assured, but as a respectable political party which is in power across large parts of our country and at the centre, should this government, should the Prime Minister not say, no, let us push the Election Commission to delay the elections?
Yes. According to me, the election should have been delayed. It should have been deferred. If you see, if there is a war or some situation like that, the elections get deferred. This is a matter of
This is a war. This is a war.
This is a war. Yes, it is a war. And it should have been deferred by the Election Commission. And the way these rallies are taking place, whichever party is doing it, they are all doing it wrong. According to me, it should not have been done.
And they are risking lives of people. What excuse does the Congress have for going ahead with these massive rallies in parts of Uttar Pradesh? We've seen Priyanka Gandhi Vadra attract huge crowds in UP at a time or in a situation like this.
Thank God you acknowledge that Congress is drawing huge crowds in Uttar Pradesh. Otherwise,
no, but sir, that's exactly the point that you should not be making on this program.
Well, thank you so much for acknowledging, even if it is backhanded.
Yeah, I would like you to acknowledge that all those people are going to be safe. I know you can't do that.
Vishnu, the fact of the matter is,
to see her, they will not give her vote.
Thank you. The fact of the matter, Vishnu, is as the king, so will be the subjects. Who is the king right now? Not the Supreme Court of India. I'm sorry, Mr. Vats. Supreme Court का शासन नहीं है इस देश पर अभी तक, मोदी जी का है. So, if Mr. Narendra Modi as Prime Minister shows a sense of responsibility, He's attended 14 rallies in Uttar Pradesh in the last few weeks. In the next 3 days, Mr. Amit Shah will do rallies, road shows, and what have you in Uttar Pradesh, in several districts of Uttar Pradesh, Mirzapur, Bhadoi, Kabir Nagar, several districts of Uttar Pradesh, Bareilly.
Please talk about your own political leaders, what they are going to interrupt.
Why would he interrupt? Why would he interrupt? Why would he allow him to interrupt? I didn't interrupt anyone. What is this going on? अरे आपका शासन है, निर्णय आप लीजिए ना, हम पर क्यों बोलेंगे? भाई हर चीज कांग्रेस ही करेगी तो हमें आने दीजिए सत्ता में, फिर हम ही करेंगे जो भी करना होगा। सत्ता आपकी है लेकिन जिम्मेदारी कांग्रेस की। ये कौन सा नया नियम आ गया आपका?
हमने कहा कांग्रेस की जिम्मेदारी बोली है? हमने तो एक बार भी आपका नाम नहीं लिया।
मत बोलिए, पहली बात तो इसमें बोलने की आदत खराब है आपकी। चुप रहिए थोड़ी देर, जब आपकी बारी आएगी तब बोलिएगा।
All right, both of you, let's not get personal. Let's not get personal over here. All right, 1 second. I want to go across to Nahid Lari Khan.
To take decisions.
Nahid
even if those decisions
you know, we saw. I believe Akhilesh Yadav for a period of time chose because family members of his started falling unwell. His wife, I believe, was unwell with COVID. He chose initially that he was going to carry on with his rallies. Then he decided to hold off for a few days, but he's back there right now. Firstly, I think he's back after just 4 days. Am I right?
Yeah, I'll let you know. See, one thing I would like to make it very clear that the government was fully aware that UP is the biggest state and the elections are going to take place in UP in the beginning of 2022. My question is that why did not the government speed up the vaccination drive? Why didn't the government reduce the gap of the second dose? Like from 84 days, it should have been reduced to 6 weeks. Why didn't the government accelerate the booster dose to frontline workers as well as to the adults? It is not that we don't have vaccine, Mr. Soom. We have enough vaccine.
But Nahid, does that mean that you carry on? You carry on with this?
Outside. No, I'll let you. I'll answer you to that also. Okay. I'll answer that also. Just allow me some time. We have enough vaccine. That's why it's being exported so that the rich family company, the rich friends companies, BJPs, they earn a lot of money. But the experts, as per the experts, the vaccination drive is at 40% of our capacity. Now this is of something of concern. And if you see the government statements itself is contradictory. On one hand, the government is saying that Omicron se zyada asar nahi hoga. And if you see the data 24 hours back, only 6,945 cases took place in full country, and around 170 or something like 200 deaths took place. That means there's a decline in COVID cases. On one hand, the government itself is saying that there's decline in COVID cases, and when the COVID cases were 40,000 per day and deaths around 1,000 per
those
day,
numbers are
then
clearly
this very
going up
BJP
right now.
was doing election rallies in Bengal, Tamil Nadu and Kerala. Why they were doing election rallies there? Because they were sure that they're forming the government there. Now in Uttar Pradesh, they're confident that they're being booted out by the public. And so they're showing that they're really concerned about
I'm not
COVID.
talking about elections. I'm talking about how elections should not be held down. It is true of the Samajwadi Party as well. Varun Khera, let me come to you. Varun Khera, the owner of the Imperial Spice and Cafe. One sec. One moment, Nahid, no political point taking over here. We are trying to protect lives. Varun Khera, your business is going to be affected like countless other businesses from 10 p.m. tonight, 11 p.m. tonight, I believe, for the next several days. Delhi on a yellow alert now because of rising numbers. And yet you see a situation where there are rules which are placed on you, and perhaps correctly so in a situation like this. On the other hand, there are others, including all our political participants on this program, who wouldn't think twice about attending a political rally by their leader. How do you feel about that?
Well, this is going to be very personal right now, Vishnu, and I would drive the attention of all the people who are the speakers tonight on this show. I would like to give them a soft and a polite applause. It is very sad, I must say. You must be thinking that the population is going to vote for you. You are doing your vote bank, Rajniti. You're doing your political bashing, but I will tell you, the people of India are very sad to see the scenario of every speaker on every political show or the news show. All you guys have to do is just bash each other, and the businesses of this country, the employment in the country, the people of the country are suffering very badly post-corona. You guys are just not aware of it. I don't know what booster drive or booster vaccination the government is providing or the political parties are providing to their supporters who can actually flout the norms, who don't care about the DDMA. There is no 50% capacity. There's nothing at all which is mentioned. And all we see is that the Jan Vishwas rally is happening. The Himachal Pradesh rallies are happening. Sidhuji is holding rallies in Chandigarh. Rallies are happening everywhere. What sort of pseudo mechanism are we trying to talk about here? This is really strange. Our businesses are going down. People don't have money to actually invest. People don't have the restaurant industry, the hospitality industry is battling. All we are doing is, at the time of New Year's, they were saying that, the people should not celebrate. There should be social responsibility. Where is that collective consciousness gone of the people? The people who are representing our nation, the people who are representing our population. I'm really sad. I'm sorry. It's a personal viewpoint, but
I think this doesn't a lot of people share that viewpoint. Dr. Rajesh Parekh, let me come to you next. It's so sad, isn't it, that this is a replay of what took place just before Delta struck a year ago. There were rallies in Bengal, there were political statements which were made, our Prime Minister included, who welcomed the crowds who were there in front of him when the entire world said, do not assemble in these numbers, please mask up. Nobody was masked up. And it's back to this situation now where vulnerable people are being attracted to political rallies, as has always been the case in our country, exactly at a time when they should not be there. Where is this going to go as far as we are as a nation?
I think the direction in which this is going to go is amply clear to people like you and I. Fortunately or unfortunately, we are not afflicted by amnesia. And I can paraphrase the words of George Santania, who 80 years ago said something to the effect that those who do not learn the lessons of history are condemned to repeat it. I am not surprised by the attitude of some of our panelists and of politicians in general. They do believe that attack is the best defense. I only wish they'd used exactly that approach towards the pandemic, attacking the virus instead of each other as a way of defending ourselves. And I'm deeply disappointed with the Election Commission of India. I don't know whether this constitutes contempt of any kind, but even if it does, I'd like to say I'm deeply disappointed with them. They failed us miserably before the second wave and in fact contributed towards it. And I believe that they are abdicating their responsibility. I might quote Pink Floyd to say to Mr. T.N. Session, how I wish you were here. I think if Mr. Session were around, none of this would have happened and millions of lives would have been saved.
Yeah. Well, I'd like to thank you all very much for being with us, but it's so sad that life is going to continue as usual. Nobody is going to care. The political rallies will continue. Nobody is going to stop them. And people are going to die, right? And nobody is going to really talk about that at all. Life goes on as usual. Is there any value to life in our country? We will always sound the alarm on COVID and Omicron, believe me, on this channel, because lives do matter. So lots of views coming in. On coup, Abhilash writes in, he says, we need a collective effort to prohibit the spread of Omicron. Politicians should act more responsibly. Political leaders are scrupulous in not following the COVID protocols, but they expect common people to follow protocols, be it COVID or the ones for elected representatives. Just a couple of views over there. But there is still a little bit of hope because booster shots are slowly coming online at the moment. It's very restricted. It's only for those who are healthcare workers or frontline workers or senior citizens, that also with comorbidities. But the process of children's vaccination is starting for those from the age of 15 and above. Part of the process is registering on the CoWIN app. It's proven to be an outstanding app. But how exactly do you go about the business if you are eligible? I spoke to R.S. Sharma, the man behind CoWIN in a sense, earlier today. Joining us, R.S. Sharma. It's always wonderful to speak to Mr. Sharma. He's very much the brains and the key implementer behind the CoWIN app. Thanks, Mr. Sharma, very much for being with us. But first, I must ask you, for senior citizens, it's being called a precautionary dose, right? So, is that what CoWIN is also going to say, a precautionary dose?
Well, thank you, Vishnu, for inviting me on your channel. It's always a pleasure to talk to you. Yes, you are right. The CoWIN platform is merely a technology backbone, and it is actually going to implement the policies of the government. So if the government calls the additional dose as the precautionary dose, so the CoWIN is also going to call it the same. So that's the way it is going to happen.
So, sir, the reason I asked that is because presumably there would then be a fourth booster, a fourth shot as well, which would be called a booster in the future. I mean, I'm just trying to.
No, well, I can't sort of imagine as to what fourth will be called or what fifth will be called. Let's limit ourselves to this particular issue.
So it will be called a precautionary dose, and you are confirming that. I mean, that's important to note. So absolutely. If there is a senior citizen with comorbidities who is eligible, what does she or he need to do?
Well, first of all, he or she is already registered on our platform, right, because he or she has already got 2 doses, right? That's number one. And number two, we also know when was the last dose he or she took. So therefore, from that point onward, when are his or her 39 weeks or 9 months going to be completed? So as soon as that happens, the CoWIN platform will issue an SMS to him or her, informing him or her that, you know, your precautionary dose is now due in case you have comorbidity. Right. So in case he or she has, she can go to the CoWIN platform, use the same mobile number with which she or he had done 2 doses, and then get the appointment booked for the precautionary dose.
So this is important because all senior citizens will get an alert, and it's only those senior citizens who have comorbidities who may choose to act, correct?
Correct. That's what we plan to do.
Right, so that's interesting, yeah.
Yeah, so otherwise, you know, because we have all the data is with us. So we will inform the senior citizens that now you are eligible in case you have comorbidity. Similarly, we will also inform all the frontline and health workers to essentially say that now you have done these 2 doses have been administered to you. Your last dose was 9 months or more prior to today, and therefore you are also eligible for a precautionary dose, and please come and have that dose administered to you.
So if a senior citizen, sir, is to book that 3rd dose through CoWIN and have received 2 doses of, let's say, Covishield or Covaxin for that matter, as per the existing policy, and as I understand it, it's the same dose for the precautionary dose. So on the interface, will appointments only be for the vaccine that they've already taken?
Well, I must share with you that I am not very clear about the decision as to whether the 3rd dose, that precautionary dose, will be of the same, brand as the first 2 or a different brand. As and when that decision is taken, because this whole thing is going to happen from 10th January onwards. So accordingly, the CoWIN platform will be configured to show only those centers which are different, or those centers which are the same centers, same dose which was taken by the person earlier.
Right. So that's again an important point. Whatever a person is eligible for will be shown on CoWIN, right? In terms of the appointment booking.
Absolutely.
Senior citizens also need to upload a document. What is that document, sir?
No, they don't need to upload a document, but as you know, there was a time when we had said that 45 to 60 years of age, people with comorbidity will be able to get a jab. You remember those initial periods? And then the Ministry of Health had prescribed absolutely detailed guidelines, which actually, prescribed as to what are the eligible conditions of comorbidity and what will be the format of the certificate. Those same rules will continue to apply in case of this comorbidity certificate also.
So that is an entry, sir? Is that an entry in CoWIN, or does an individual need to take, a letter from a doctor at the time of getting the injection after registering?
Absolutely. This is just, the CoWIN is going to ask him or her that, do you suffer from comorbidity? If he says no, then obviously it will not allow him to register for the 3rd, the precautionary jab. But in case he or she says yes, then it will advise him or her that you take the certificate at the time of vaccination. And they will have to show to the vaccinator the certificate. The vaccinator may choose to upload that certificate in the COVID platform.
What if a vaccinator rejects the letter? Because that will happen quite frequently. It's bound to happen in a country as large as ours. What happens to the application an individual has made? Does it get erased?
It is not an application. It's a certificate by a doctor. So there is no question of its rejection if it is a valid certificate. Why should somebody reject the certificate?
So it's an assumption that all of the certificates which are given will be valid, and therefore the process of getting the injection should happen smoothly. Now, if you recall, sir, last year there was this big rush on vaccines because the number of vaccines were low, and that also had a bit of an impact on COVID as well, because I recall a time when, we were fighting to get a second jab, for example. There were just not enough spaces, just not enough spots. Do we have a sufficient number of vaccines now to ensure that your system will work efficiently in giving a person an appointment?
The system has always worked efficiently. So first of all, I want to sort of dissuade, or I want to contradict that.
No, I take your point. The system has worked. There weren't enough doses. Your hands were tied in a sense.
What we are saying is, I think that situation was a temporary situation,
right,
where the demand had outstripped the supply, so to say. But that situation does not exist anymore. We have adequate supply, and situation is eased out, so much so that 80% of the people are going and getting the jab without registration on COVID, which is good, that people can just walk in and get the vaccines. So I don't think such situation will arise now.
Let's talk about children, sir, 15 to 18-year-olds.
Right.
So what is a 15 to 18-year-old? How do they register on COVID? A 15-year-old is still a child, so would it be on their parents' device?
So, well, let me divide this problem. One is registration. So if the parents have husband and wife have already registered on their mobile, they can add 2 more, the children can be added. As long as the number of persons on a mobile registered is less than 4, equal to 4, they can add. If not, then a new mobile number can be used to create a separate account for the children. So that's one part. Secondly, this process is starting on 3rd of January. So we are opening the registration for children on 1st of January. That's 2 days before the vaccination. Thirdly, because children do not have the voter ID card or maybe driving licenses also, so therefore we are adding the school certificate, the school identity card, as one of the valid documents in case of children. Fourthly, the children, basically we are not going into the exact month and date and when will they complete 17 years or 15 years. We are saying, we are basically simplifying the process that anybody who is born in the year 2007, 2006 or 2005 is eligible for getting vaccinated. So
no, but sir, Mr. Sharma, wouldn't you then have a problem if these children want to travel abroad, and you had that entire issue with the UK who said they have a problem with COVID because the date of birth was not mentioned, and
we will basically, date of birth can be mentioned, and now those people who want to travel will also be able to link their passports with that. You are aware of all those things, changes which have been done in COVID. So therefore that problem will not arise. But please understand, we believe in minimal data collection. We don't believe in all kinds of data collection. So for 95% of the children, only year of birth will do. That's not a problem.
And those who want to get a specific date on their passport, they link it, right, on COVID, and that's it.
Absolutely. COVID has now the provisions for domestic certificate and also for international certificates. So those international certificates can be downloaded, linked with passport, and now our process is absolutely recognized by, the process is absolutely robust in terms of certificate. So also the certificate process will also be similar for children as it has been for the other categories of people.
So, sir, again, children don't need to upload anything. When they go for their shot, they need to carry their school ID or whatever it is that they have, Aadhaar card presumably.
Absolutely.
Right. So there is no uploading business over here.
There's no uploading business earlier also. There's no uploading business from the registration. There's no uploading business.
And walk-ins happen as usual. And if that happens, then it gets added onto CoWIN at a subsequent stage.
Absolutely.
Right. So all of these options.
CoWIN ultimately digitizes the process, either from the point of registration onwards, where the citizen takes the lead, or from the point of vaccination onwards, where the vaccinator takes the lead and enters the data.
All right, Mr. Sharma, thank you very much for speaking to us and explaining what the process going forward for children and senior citizens is going to be. Thank you very much indeed.
Thank you very much, Vishnu, for having me on your platform.